Okay, so I'm here today to do an intramuscular and subcutaneous injection on Mr. Mancini. Before I get started, I need to check his MAR and make sure it is his MAR, all the pages are there, and the orders for the injections are also there as well. I also need to make sure that the 8 rights of medication administration are being met. So right patient, right medication, right route, right reason, right site, right frequency, right time. I also need to recognize that Mr. Mancini is allergic to codeine, but that's not an issue with these medications I'm injecting today. Mr. Mancini also has a normal medium body build, giving the gauges for the needles within normal range. So for intramuscular, it's 20 to 25, and subcutaneous is 25 to 27. Okay, so now I am preparing the injections for Mr. Mancini. So the syringes, for the intramuscular, I'm injecting 0.5 milliliters, and for the subcutaneous, I'm injecting 1 milliliter. So I have chosen anywhere between 1 to 3 milliliter syringe sizes appropriate. So I'm going to start off with hand hygiene. I'm going to start off with my subcutaneous injection. So I'm going to open it. I'm going to open up the vial, and once I do this, I'm going to clean it off just to make sure everything is clean. So for the subcutaneous, as I mentioned before, I'm injecting 1 milliliter. So to start off, I'm going to take the cap off of the needle. I'm going to be sure not to touch the barrel, just to keep it sterile. I'm going to pull back to 1 milliliter of how much I'm going to be injecting. I'm doing this just to keep the negative pressure in the vial. So I'm going to stop it, turn it upside down. I'm going to inject the 1 milliliter of air and pull the medication to the correct volume. I'm going to go a bit past 1 milliliter just to make sure that I can get all the air bubbles out after. So I'm just going to flick it and make sure there is exactly 1 milliliter of medication. So now that I have that prepared, I'm going to cap it and prepare my IM injection.
Okay, good.
Okay, so now for the IM injection, I'm going to open up the needle and syringe. I'm also getting the medication from the vial, so I'm going to clean it as well, just to make sure it's clean. So for the IM, I'm injecting 0.5 milliliters of medication. So I'm going to take the cap off of the needle, and as I did before, I'm going to pull it down to 0.5 to make sure that I'm creating a negative pressure in the vial. Okay, so I'm injecting 0.5 of the air into the vial, and now taking out 0.5 of the solution. I'm going to get rid of all the air bubbles and cap the needle. And now I'm ready to go to the patient with my syringes and needles ready, and also cleaning up my work area after.
Go.
Okay, so I am here now to identify where I'm going to be injecting these needles into Mr. Mancini. So I'm going to start off with hand hygiene. So just for this, I don't need to glove. I'm going to start off with the IM injection. So to localize where I'm going to be doing this, I'm going to place my palm on the greater trochanter of the thigh with my fingers nearing the iliac crest. And then I'm going to be inserting between my two dominant fingers.
Go.
Okay, so for a sub-Q injection, I'm just localizing where I'm going to be doing it. I'm going to be doing it in the fatty area of the stomach, which is underneath the belly button, just down here, and I'll just pinch it and make sure that there's enough adipose tissue there for a subcutaneous injection.
Okay.
So now to actually administer the injections, I'm going to start off with hand hygiene, and I'm going to glove just as extra precautions. So I'm going to start off with the subcutaneous injection. So for this, you would do it on a 45-degree angle into the adipose tissue. For the sub-Q injection, I chose a 26 gauge needle, which is within range and appropriate for Mr. Mancini. So I've already landmarked and palpated the site of injection, which is on the stomach. So I'm going to now cleanse the injection site from exactly where I want to and working my way out just to cleanse the whole area. So obviously before I do this, I would explain to Mr. Mancini what I'm doing and why I'm doing it, and the medication and the treatment that it would help with. So I'm starting with my subcutaneous, so I would uncap it. When I do this, as I said before, going in at a 45-degree angle into the adipose tissue. Inject the solution, retract at the same angle, and recap the needle. Okay, so now to administer Mr. Mancini's intramuscular injection, I already palpated and identified where I want to inject. So I'm going to start off again with cleaning the injection site. So for an intramuscular injection, we go in at a 90-degree angle, almost like a dart, and making sure that you go into the muscle with the needle. So I'm going to uncap. Inject. And recap the needle. And now I'll dispose of my supplies in the sharps container and the rest in the garbage. Okay, so now that I've given Mr. Mancini both of his injections today, I need to document. I would do that on his medication administration record. I would do this to keep a record of it, to let other health professionals know looking after him that they have been administered with all the 8 rates of medication.